test we'll look at the hip is called the Scour Test. Scour Test assesses numerous possible pathologies, including osteoarthritis at the hip, also looking at potential labral tear, osteochondritis dissecans, and other pathologies. With the test, the passive test, you take the patient's knee in 90 degrees of hip flexion, and then you can abduct or adduct as you're internally, externally rotating. What you're trying to do is either catch the labrum or you're rubbing, compressing the articular surfaces to see if there's crepitus, if there's pain, if there's catching, if there's clicking. Depending on the response, will give you a clue of what structures might be involved. So first we'll start with an adducted. I'm giving an axial load, I'm compressing, and doing this at the same time I'm going to internally and externally rotate the hip. And again, checking for catching, discomfort, for clicking, and rubbing or crepitus. This test, in some cases too, given the axial load, the patient may complain of pain in the mid-buttock region, which could be indicative of a unilateral SI arthritis or inflammation. So you want to also rule that out with this test too. You can also do the test more with it abducted as I'm giving an axial load, and this will compress the joint surfaces a little bit more and involve the labrum a little bit less in this case. Again, we're going into internal, external rotation. The test can also be repeated with more flexion and more extension, which is going to hit different parts of the joint surface and also different parts of the labrum. So again, it can be more adducted, abducted, all with internal, external rotation and more flexion and extension, trying to catch all the different surfaces of the hip joint. And that's called the Scour test.